Hello, and welcome to our live KFF Health News recap of the Health and Human Services fiscal 2026 budget hearings in the House and Senate, featuring Health and Human Services Secretary Robert F. Kennedy Jr. I'm Julie Rovner, Chief Washington Correspondent here at KFF Health News and host of our weekly podcast, What the Health. In case you're watching this later, we're recording this at 4 p.m. on Wednesday, May 14th. I'm joined today by my KFF Health News colleagues, Darius Tahir. Hi, Darius. And Stephanie Armour.
Hi, nice to be
here.
And
along with KFF Senior Vice President Jen Cates.
Hi, everyone.
So this is Secretary Kennedy's first public appearances on Capitol Hill since he became secretary back in February. We're going to chat amongst ourselves for, 15 or 20 minutes, and then we will open it up to your questions. If you're watching on YouTube, you can use the chat function to ask your question. If you're on Zoom, please use the Q&A button. Okay, so let's begin. It was a long day for the secretary. He started it this morning at 9:30 at the House Appropriations Subcommittee on Labor, Health and Human Services and Education. And ranking Democrat Rosa DeLauro jumped right in with some challenges for the secretary.
Mr. Secretary, this administration is recklessly and unlawfully freezing and stealing congressionally appropriated funds from a wide swath of agencies, programs, and services across the government that serve the American people. And recall that this is a violation of the Constitution. The power of the purse resides with the Congress. It's Article 1, Section 9, Clause 7. Yourself and President Trump and Elon Musk are attacking health programs to pay for tax cuts for billionaires. And by promoting quackery, we are endangering the health of the American people with pseudoscience, fear-mongering, and misinformation.
So Rosa DeLauro does not mince words. This was supposed to be a hearing about the fiscal 2026 HHS budget, which we don't know very much about yet because the HHS has only submitted a very sort of sketchy outline. But really, there was a lot about the cuts that have happened already because this was the first chance. How do you think the secretary handled himself with this sort of almost immediate onslaught?
Well, I'm happy to jump in on that one.
Please.
I thought it was really interesting. So this was like the first question at him, and he got more very much along these lines throughout the day. And he increasingly seemed to say, don't worry. First of all, we're not doing that. And don't worry, we won't do that. If you appropriate the money to me, I will spend it, which is interesting because we know from court filings, from actual documents, and all kinds of things that they have tried to claw back lots of money. The courts have largely told them they can't, but it's still contested. So it was just interesting that he actually went on record to say he wouldn't do that. So it gives the Democrats especially some ammunition later on when they seek to do it. They keep on doing this, but I was surprised.
Yeah, regular listeners of What the Health will know that every single week we have gone, with these long lists of cuts that have happened. These are not sort of things that are being sort of rumored to have happened. We're talking to actual people whose money's been cut or who haven't been able to get to it. There was a lot of talk from a number of members, both in the House and the Senate, about inability of Head Start programs to access money that's been appropriated. I was surprised by how many times, Stephanie, I think you had mentioned this. He said, if you appropriate this money, I will spend it. That is not what's happening halfway through this current fiscal year.
Right. It was very much like Field of Dreams. If you build it, they will come. It was sort of this mantra that he repeated throughout both hearings. And what I thought was especially striking about DeLauro's kind of opening salvo was it set the tone for what I thought happened with the rest of the hearing and the later hearing, which was very much Democrats kind of putting him up against a wall in terms of these cuts and their concern about what it would do with public health. And he very much kept reiterating sort of the party line of fraud, waste, and abuse. And we're not getting at actual any tangible programs that really affect people's lives and how long they'll live. But yet Democrats kept pointing out, well, what about this? What about the lead program? What about so there was a lot of back and forth that really jostled all around these cuts throughout.
There's a lot of finessing as well. I noticed a lot of Democrats would begin by saying, we agree with you on getting chemicals out of food, or we agree with you on efficiency, or this, that, the other. Everybody seemed to have their own kind of pet issue that they could start off by praising him with before, to your point, kind of bashing him over the head about another pet issue. On RFK's side, again, to your point, it's a lot of finessing about what the cuts actually mean. So there was a lot of discussion about clinical research, the kind of big cuts that are there. And at one point, he's like, well, we're cutting DEI, we're cutting gain of function research, which is a very controversial issue. And he seemed to imply that no actual clinical scientists or clinical trials were being canceled. There's been quite a bit of reporting that that's not the case, but he seemed to want to finesse that and other issues to kind of seem like
I personally know scientists who've had their funding canceled, including one who worked on the NIH campus and is moving away because she had her funding canceled. So, I mean, I know that is not necessarily the case. One thing, he clearly was there to talk about, MAHA, Make America Healthy Again. I noticed kind of the props in the Senate hearing in the afternoon. There was somebody sitting behind him in a green MAHA hat. This morning, he was sitting with a rather obvious green smoothie of some sort and a bottle of coconut water. He's trying to sort of send this message of, I guess, well, what? What do you think he's trying to send this message of?
I'm a healthy guy. If anybody remembers back to his presidential campaign, there was a very viral video of him working out in jeans and a bare chest, just doing some bench presses and, push-ups and so on and so forth. So he's always tried to make it seem as if he's a supreme healthy guy, tons of vitamins and so on and so forth. So I guess he's continuing the image there.
Well, I thought too, Darius, what was really interesting is he continued throughout both of the hearings to me to really harp on or try to focus on, hammer on what the agency has been doing with regards to food and, getting chemicals out. But it seemed to me that the Democrats were much more interested in vaccine, what he said about vaccines. And so it really seemed like he was trying to say one thing and Democrats were trying to pin him down on another. So how they all seem to be like, yes, getting chemicals out of food is good, but what about this?
So
yeah, I think it speaks to the fact that the MAHA agenda idea is not unpopular. I mean, I think it's a good agenda, right? It actually speaks to what a lot of people in the United States experience, these broad health challenges. But it's been used, I think, and what the Democrats were saying is to take away and reductions in all other areas, public health, vaccines, et cetera. So the agenda itself is not an unpopular one, but it's the other stuff around that's going on. Yeah.
Well, speaking. Oh, go ahead.
Sorry.
Sorry.
Yeah, no problem. I think it flummoxes Democrats a little bit because it's this conservative wellness agenda that is not quite what Democrats are used to hearing. It's this message that, you personally can do a lot of stuff such as exercise, eating healthy, and so on, and you'll be fine. And if there are problems, it's because of something on the outside, that some, mysterious force like vaccines and so on. And Democrats, don't necessarily know how to handle it in the traditional sort of Paul Ryan, we want to cut your Medicaid kind of sense.
Yeah, that's true.
Definitely.
So So one of the reasons that we wanted to do this is because we were all anxiously awaiting for Kennedy to come into the same room with Senator Bill Cassidy, who is a doctor, who does believe in vaccines, who was very undecided about voting for Kennedy when he was up, for his confirmation, because he was worried about many of the things that he'd said about vaccines. And Kennedy made a whole lot of promises in those nomination hearings that we talked about. Senator Cassidy's is chairman of the Health Committee. He's also on the Finance Committee, which is a committee that voted on the nomination. And he hasn't necessarily lived up to a lot of them. Cassidy, on the other hand, seemed very sort of quiet, shall we say. Here's something of what he had to say. The only time he sort of hinted about the fact that he might not be super thrilled with everything that's happened since Kennedy has come to office.
Mr. Secretary, once more, no one can set the record straight better than you to explain how the department will maintain its critical duties and implement change important to Americans' health. By providing this clarity, we in Congress will be able to advocate for shared priorities in future legislation, and you will gain the trust of the American people, putting their minds at ease.
So while Cassidy was being, very polite, Connecticut Senator Chris Murphy, I think, was his anger manager, if you will, and said some of the things I think we expected maybe Cassidy was going to say, or that at least Cassidy was thinking. Here's Chris Murphy.
I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite.
Yeah, we've been saying this for weeks and weeks since Kennedy has taken sort of action after action that he promised he wouldn't when it comes to vaccines. I was surprised by Cassidy's reticence to say anything that could be construed as criticism. Were you guys?
He kind of popped up at the end there. There was a little exchange where he's like, well, actually this thing you said about vaccines was not accurate. But other than that, he was quiet as a dormouse. So
Yeah, I was surprised. Well, first of all, on this issue of money, I believe what Senator Murphy is referring to is this $11 billion that the HHS tried to claw back from states that Congress had appropriated for COVID, and then Congress decided that it said we could repurpose that and use it for vaccines, public health infrastructure, and all that money they tried to take back, and the court said, no, you can't do that. So it's been temporarily halted. So that was interesting. And then secondarily, he many times today in both hearings, Secretary Kennedy had an opportunity to come out and say, I do support measles vaccine in a strong way, even if he has cryptic views about other things, that he didn't do it at all. I mean, he was actually very, he held back a lot, and I was surprised by that. And then not having Cassidy jump on that was interesting. He's certainly done it on social media, but not in the hearing.
I think that also one of the things that it underscores is how careful Kennedy is being around the issue of talking about vaccines, because right now there's a real rift within the MAHA movement between sort of supporters who are pleased with what he's doing in terms of the focus on food and chemicals in food. And there's a whole nother contingency that's really getting quite upset over the fact that he hasn't done more to stop vaccines, or that mRNA COVID vaccines are still available. So he's right now kind of facing a bit of a backlash from within his own supporters on vaccines. So I was especially interested to see where he would go. And I noticed he was just very, very careful, really not to support any, even at one point where he was asked, would you give your own kid the polio vaccine? He said at that point something like, I don't think I should be the one giving medical advice. I don't remember the
Which we're going to play in a second. So
yeah. Sorry
Yeah.
to get a jump, but it was that to me was really striking, considering the divisiveness right now within Maha over this.
Yeah. He
but
did have
Darius, I
the
mean,
one
he has
outburst.
done a lot on vaccines, right? Including a lot of things he said he wouldn't do.
Yeah. He did have the one outburst where he was questioned, I believe, by was it Tim Kaine, and kind of agreed, or no, it's Murphy with the fetal material and the measles vaccines and so on. So it wasn't all 100% buttoned up. So yeah.
Yeah, I will say, I mean, I've watched a lot of hearings with a lot of HHS secretaries, and I have rarely seen so much sort of you're lying, no, you're lying, no, you're lying. I mean, that did kind of surprise me. They're usually much more polite. I mean, I was a little bit surprised that Cassidy didn't have even something politely critical to say, which he really didn't. But I was also surprised by, how quick Kennedy was to react when Democrats challenged him.
Yeah, he wasn't afraid to get sort of testy or push back, which you don't always see in these kind of hearings. I mean, it's true there wasn't a whole lot of talk about the actual budget, but he very much was not being placid. He was willing to go toe to toe, even in cases where he was wrong and corrected by Cassidy later.
So, Stephanie, as you mentioned, in the House hearing this morning, there was a very interesting exchange with Representative Mark Pocan of Wisconsin. Let's hear that.
Something that might be helpful is you've previously said you vaccinated your children. Just because I think this is a helpful answer, and this isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give the medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make.
But that's kind of your jurisdiction, because CDC does give. Right. I'm not trying to do it as a gotcha. It's just
what we're going to try to do is to lay out the pros and cons, the risks and benefits accurately as we understand them.
Okay.
Yeah, nobody should take medical advice from the Secretary of Health and Human Services. That seems a little bit odd.
The new one.
Very comfortable about offering advice on other subjects, though, like food or chemicals or whether or not
I noticed at one point
was another one. Yeah.
But he was also making some comments about some international programs that HHS doesn't oversee. So he's sort of quick to wander outside of the bounds of his authority, but not so quick to say, I mean, just somebody please, give me a reality check here. The Secretary of Health and Human Services is supposed to be the lead health spokesperson for the federal government, right? Jen, you're nodding. Not my imagination.
That's his or her job, is to provide advice to the nation based on information and evidence. So it is actually his job to do that. So it was an interesting way to answer that question. And also, I mean, I think what I also was hearing is he was saying medical advice, which is true. He probably shouldn't be advising an individual about whether they should get cardiac surgery. That's for but this is public health advice, which is quite different. You give the advice, you make the recommendation. Obviously, any individual family, parent can make their own decision based on that, but that's what the job of the secretary is.
Yeah. And obviously we've had, there's a lot of discussion about what is appropriate public health advice. Well, another recurring theme, I think, in both of the hearings was the impact of the ongoing cuts, the cuts that HHS has made already, both to HHS staff, which has been reduced by something in the neighborhood of a quarter, as well as to grants and programs. We talked earlier about the $11 billion that's being clawed back. Here's Wisconsin Senator Tammy Baldwin, who was complaining about efforts by some of her constituents to get help with a lead poisoning problem in schools in Milwaukee.
Do you think lead poisoning in children is a significant concern?
Is lead poisoning?
In children, a significant concern?
It's a extremely significant concern.
Thank you. Then I would like to know why your department has effectively shut down the very program to address lead poisoning in children. The city of Milwaukee requested assistance from the CDC to help the city respond to lead poisoning cases tied to public schools. 6 schools have been closed, displacing more than 1,800 school children. The request for federal assistance was denied because of lack of staff. The entire childhood lead poisoning branch has been fired. In the words of a Milwaukee mom, it really sends a message of, you don't matter. I don't know what you would say to parents who must now test their children for lead and deal with school closures. But do you intend to eliminate this branch at CDC, yes or no?
No, we do not.
Okay. Because you cannot tell us that you want to make America healthy again when you are willfully destroying programs that keep children safe and healthy from lead poisoning. Congress dedicated $51 million in funding for this particular program. But when a community asks for help to prevent lifelong complications for children, and there is no one there to pick up the phone, and it's not because this program is ineffective, it's because you fired the entire team whose job it is to support communities like Milwaukee.
Yeah, there was a lot of that, people, these hearings are always parochial. You get senators and members of Congress coming in and, talking about their particular issue, which is because sometimes it's the only chance they have to, talk with these people in person, in public, with the cameras on. So it is not infrequent that you would get that sort of thing. But I was a little bit surprised by sort of how much there was, how much he didn't talk about what it is that he's actually trying to do, that the effort to reorganize. He did say there is now a court order and he's not allowed to talk about it, but he seemed sort of unable to defend a lot of these changes. Some of them he suggested he didn't know about. Some of them he suggested he could fix, just if people would call him at his office the next day.
Yeah, he was grilled at one point about domestic violence programming and said, well, that's something that Trump really values. He was grilled on other cuts. He was grilled at one point about someone who was in a clinical trial at NIH who'd had a 4-week delay. And he stepped up and said, well, have that person, I'll be in touch with you. Like there were a lot of individual things that he almost seemed sometimes surprised by a little. Like I hadn't heard that, or I was told this, which I thought very revealing as well, because it made me wonder how much was he really involved in a lot of these cuts. That was, I thought, really interesting.
You sort of addressed that during one of the questions where he was like, well, Doge and OPM came up with some, and I had some input, but didn't stop some others. So it was, I'm sure the dedicated timelineologists are,
I think the other thing to watch going forward, I mean, a lot of what he said too, when there was you got rid of this program, he said, no, we folded that in to MAHA. No, we've moved that over. That's not really clear in their, the 2 documents that exist and in the public sphere, the short budget, but also the leaked passback really eliminated so much more than was moved. So I think it's a really, that he basically said that. And I think this gives members of both sides the chance to go and say, where is this program or where is this office that you said you've moved? Because that wasn't clear from what was provided to them.
And he did say it would be hard. He made some comment like it'll be hard for a bit. Like that reminded me a little bit of President Trump in terms of like the tariff cuts, just give it a little time was kind of the message I was hearing.
So he also, as we mentioned earlier, got a little bit testy when he got challenged. This was quite the exchange that jumped out to me this morning with Democratic Representative Josh Harder from California.
And the recent budget that is being discussed in the House right now would leave 50,000 people in my community without health insurance. So Secretary Kennedy, my question for you is, why do you think that a community like mine doesn't deserve access to that same basic health care provided by Medicaid that you benefited from?
I do believe they are. I do believe, and that is the design of the Medicaid program.
So do you disagree with the cuts that are being proposed for Medicaid right now?
Oh, the cuts to, this is I don't know if you understand this or whether you're just mouthing, the Democratic talking points. The cuts to Medicaid are for fraud, waste, and abuse, and I'll tell you what that means.
Yeah, I've never seen a secretary accuse a member of the subcommittee that controls their budget of mouthing that party's talking points.
Yeah, it speaks to how testy he was getting, especially as the day of hearings went on. You could definitely see that people were able to rankle him a bit more, and he was getting a little bit more defensive about. I do think that was a very good point you raised, Julie, that he didn't have a lot of chance, or he didn't spin it a lot in terms of a chance to talk about the accomplishments as much as it was a lot of questioning going on. He didn't really have a chance to say, yes, but we're doing this, but we're doing this.
Yeah. And also just to note that what's being discussed around Medicaid isn't that, yes, fraud and abuse have been brought up, but there's a lot more on the table right now about Medicaid. So he didn't really touch on any of that. So real actual changes to the program being proposed.
Yeah, he sort of kind of led up to it, and later on in that exchange, like, well, we're doing the fraud, the waste, the abuse. We found 1 million people who are getting Medicaid in one state, 1 million more, and he's like, and then there's the work requirements, which you can agree or disagree, but seems a little different than what most people would think of as fraud, waste, and abuse. But
yeah, although speaking of talking points, those are he was parroting the Republicans' talking points about fraud, waste, and abuse.
Well, and considering how much is on the chopping block with Medicaid, it was really striking to me how very little time was given or devoted to it in either of the hearings. There was some, but to the numbers that we're talking about in terms of changes to the program and the number of uninsured, I thought it would get a little more attention than it did.
So there were a lot of indications that despite the secretary's promises of radical transparency during his confirmation hearings, he seems to be doing a lot of ad hoc restorations of programs, sort of, one member of Congress at a time calls them up and suddenly people are reinstated. At least one Democrat in the House hearing this morning, I was looking through, but I couldn't find in my notes who it was, asked if there was a dedicated line for Democrats to be able to call to ask that their favorite programs be reinstated. This is not how this normally works, right?
It was particularly striking to hear every member of Congress talk about NIOSH, which is the occupational health. First, it's like, okay, we're restoring it in West Virginia, and it seemed like as the hours went on, suddenly it was open in Ohio, and then John Hickenlooper of Colorado was like, how about the firefighters out here, and Murkowski of Alaska is like, how about our fishermen from commercial fishermen of Alaska? And he's like, wow, yeah, great point.
Yeah, I mean, Lisa Murkowski
be hired at this rate.
I say Lisa Murkowski's point is that if there's no one there to do the inspections, that the fishermen in Alaska are going to be out of compliance with the Coast Guard rules, and won't be able to take their boats out. I mean, I think it's one of the ways that we often sort of don't realize how important public health is to everything that happens here, and that how these cuts are going to have ripple effects way beyond the CDC and things that we think of as traditional public health. Can you talk about that, Jen?
Definitely. I mean, I think, in general, people don't realize how much public health affects their daily life, because when things are working well, it's just in the background, right? The systems are in the background, the people are in the background, the inspections are in the background. and the systems just go on. But what we're seeing now is whether it was Doge-induced or a plan from the White House or some from HHS to just kind of cut in such a drastic way without kind of maybe understanding or thinking through the ramifications at all these levels. So that's where we're seeing this. I mean, that's where the actual examples from the senators were really, and the members are really quite helpful to hear real, how does this play out in a community? And you can sort of multiply those by, 50 states and DC and get all those same stories. But I think they're really scrambling. It seems like they're scrambling right now to try to figure out how to put a patchwork back together.
So there didn't seem to be a ton of news out of these hearings, not that there was really intended to be. But one thing that did jump out at a couple of us was his response to a question from Josh Hawley from Missouri, an active anti-abortion member, about a recent study that came out, a questionable and very controversial study about the abortion pill and whether it might have some impact on what the department does on the abortion pill. Obviously, abortion opponents would like to see HHS, further restrict the availability of the abortion pill. President Trump has tried to kind of play both sides of the abortion debate, so we haven't seen a ton of abortion action yet. Did you think, Darius, that Kennedy sort of tipped his hand about where HHS might be going?
He sort of suggested that they should take a look at the labeling based on this study put out by a think tank. And so that was one thing. The other kind of revealing thing, to Stephanie's point, was the question that didn't get asked. Josh Hawley has been kind of active in the media saying he's against Medicaid cuts. This would seem to be a prime opportunity to kind of set up that political point more. And he passed on it. So I think that's kind of revealing, as we kind of prognosticate about the fate of this reconciliation bill, that Josh Hawley chose not to ask about that.
Yeah, I was actually surprised at that.
Yeah.
Stephanie, you wanted to add something?
Oh, he did seem to indicate that he was going to leave it sounded to me, and correct me if I'm wrong, he was going to leave like some final decisions about the abortion pill up to the White House and Trump. Like it seemed like he was very much knocking that ball back to the White House a little bit.
I thought he was actually kicking it to Marty McCary at FDA. It's like, to get this hot potato off of my desk.
And
then let the head of FDA decide.
Julie, to your point about there wasn't that much news, I agree, but I do think the lack of endorsement of the measles vaccine right now is pretty interesting. And this has been he's gone back and forth on it, but given that the outbreak right now in the US is one of the most serious we've had, likely, we're on a path to lose measles elimination status in the United States. And the reason is because kids are unvaccinated. That's literally the main reason. To not be able to come out and say it in this context, I think was pretty notable.
Although then he did say at the second hearing, he said, I support the measles vaccine. Go back and look at the transcript, but I didn't see that in the transcript.
Yeah,
well, we actually just played the cut. It was when he told Mark Pocan, he said, would you vaccinate your kids? And he said, probably.
That was what he said about it. Exactly. Yeah. So, but he had a lot of chances to sort of come out and say, we're having this out. He actually tried to downplay the outbreak.
Yes, he said there were more cases in Western Europe and Canada, and sort of left unsaid that therefore the vaccine is not effective, or not the only thing. Which I'll leave to the epidemiologists to.
All right. Well, we have questions that are rolling in, so I'm going to turn to some of your questions. Here's a provocative one: do these hearings have the potential to remove RFK Jr. from his post? I don't think so. Did anybody think he did anything that would in any way threaten his position? No,
I don't think so.
I see shaking of heads. I mean, I think it takes a lot, particularly in this administration. In general, though, it takes a lot for somebody to do something that, gets them removed from their post. The last time an HHS secretary was forced to resign was for commandeering airplanes for personal use, basically. Which so far no one has said anything about. All right, here's another one. Please fact check the suggestion by RFK Jr. NIH-funded gain-of-function research in China caused the COVID-19 epidemic.
I didn't hear that suggestion. I don't think that's.
Well,
I did.
It did, and we probably don't even have time on this to go into it. But let's just say that is not there's a lot of controversial information around that, and it is. there's so much that's conflated about what actually was funded and what it did and where COVID's origins are from, that to present it as fact is not, it's not actually true. So
Although you will note the White House Gov page has updated. There's an updated page on COVID that that speaks to that theory as well. So I do think you're seeing that more and more from a public. Yeah.
No,
So
this
he
is
was
this is they've
updating
been
what-
exactly. So he was saying that, but I think that for people who might not be aware, that is not a done
settled.
deal, nor is it. Yeah.
Yes, there seems to be no great agreement on how it started, only that it started in Wuhan. Kennedy kept reiterating the redundancy of agency initiatives: 42 programs dedicated to women's health, 62 programs dedicated to another initiative, I think it was DEI, 4 IT systems that don't talk to each other. Is there justification or documentation to his argument?
I think we reporters can speak to a little bit of a parochial aspect of this. He mentioned the communications offices, of which there are several, and that have been consolidated. There are certainly fewer staffers who deal with that, and I think we tend to get less specific answers from the staffers that remain. So the consolidation and efficiency is a little bit in the eye of the beholder on that specific idea.
But I think, for those of us, so I do policy, so I've interacted with lots of different administrations, and I think no one would disagree that there is redundancy, and there are systems that, just some agencies use Zoom and some use Teams and some use, things like that, which don't, and there's different systems for procurement. That's true. And so I think stepping back, whether it's HHS or other agencies, there's the idea that this new administration should take a look and maybe try to figure out some more efficient ways. I don't think that I think most people would get behind. What has actually happened doesn't seem to be that, but yes, there are redundancies. Whether they are going to solve that, it sounds like there's a lot of holes now, so that's not really that same kind of consolidation.
Yeah,
sort
I
of
think
chopping things out.
That's totally true. I think that his point continued to be that we're dealing with redundancies, but then you have a situation where, for example, at the FDA, they laid off so many communication specialists that they can't alert people when there's an outbreak, or they're not getting letters out to companies that have had food safety things because they don't have enough staff.
Exactly.
So I think it's what Democrats were getting. The question they kept trying to say is, did you go a little too far? Was this done a little too hastily? And he kept saying, well, we can bring some people back.
Not efficient. Not efficient to bring people back like that.
Yeah, as somebody pointed out, there are tens, or there are at least thousands, I don't know whether it's tens of thousands, of HHS employees who are currently on administrative leave. In other words, they're being paid, but they are not working. A lot of this is hung up in various court suits, but it doesn't seem to be a very good way. I apologize for the barking dog. It doesn't seem to be a very good way to make this agency run better or smarter.
Yeah.
All right, here's another question from it said, from the National Patient Advocate Foundation's perspective, a subtle streak of patient blame seems to underpin the MAHA agenda and messaging without acknowledging HHS's accountability for addressing the complexity of our health system, research enterprise, or healthcare access barriers that permeate the patient's experience. Were there any nuggets in the testimony that suggest the Secretary recognizes that his HHS role is to help people who have complex or chronic conditions as part of promoting public health?
That's a really good question. I actually really like that question, and I'd love to hear other people's perspectives who are watching this, because I didn't hear that. I did hear a lot of and I have heard a lot of the chronic disease is caused by the environment or what you eat or exercise. And you're right, I wasn't hearing a lot about things like food deserts or access to care or preventive care. And maybe it's just me that I was missing hearing that, but I'd love to hear what Darius or Jen thinks about that too.
I guess to phrase it slightly differently, and I think I mentioned this earlier, it's sort of conservative wellness is what I kind of think of it as, which is pushing a lot of responsibility for being healthy on individual patients and implying that if that doesn't happen, oftentimes it's the case of corruption, said corruption tons and tons of times, or some other kind of malign force, perhaps. So I think kind of perceive similar trends as the questioner as to whether or not they want to help chronic disease. I think in RFK's mind, this is the way to help chronic disease. So I guess the answer to your question is, I think RFK and the questioner are kind of aiming at similar goals in their own mind. Whether or not you like that is, I think, up to you.
Well, that's another example where there is a lot of chronic disease in America, and he could have, we didn't really get to hear much about that. He did, he's said this before, but he did talk about long COVID, very supportive of addressing long COVID. So he reiterated that view as well.
Of course, he talked about long COVID because it was pointed out that the long COVID office had been closed and everyone fired.
Yeah. Exactly.
So, and then he said, "Oh yeah, long COVID's a big problem." And sort of,
we'll get that office back.
There was a lot of sort of passing back and forth, and a lot of members, Democrats too, seem to be trying to give him the benefit of the doubt. That said, a lot of this stuff happened before you took over in February. I mean, they started making these cuts as soon as Trump took office. Clearly, a lot of it was coming from the White House and the Office of Management and Budget, and they were trying to give him sort of an out to say, Doge did this, I didn't. And he didn't seem to want to do that.
Yeah, he didn't. Yeah.
Yeah. All right. Well,
because that's when he went back. I think Stephanie said this earlier, that he said, well, I don't know if that was Doge or if it was the White House. Yes, it was when he could have taken the out a little bit more, but he didn't. Yeah.
Yeah, I mean, he did seem to be, on the one hand, he pushed back and said a lot of these cuts that we know are happening aren't happening. On the other hand, he seemed to be saying, the cuts that are happening that I'll acknowledge I'm going to take responsibility for, which, okay. All right, this is an interesting question. Are you hearing any signals from Congress that they will push back in a meaningful way on these cuts?
Beyond what we heard today, I mean, there's the cuts that have been made that are documented, and what the pushback is just what we heard today, and I don't know if that's not enough to really do it. The courts are probably the place, but then there's separately is the 26 budget, which was actually supposed to be the topic of today, which we didn't get to. But yes, I don't see that happening. The pushback.
Yeah, and we should point out that that the 26 budget, to the extent that we know about it, calls for even broader, even bigger cuts than we've seen already. I mean, what impact would the 26 budget have on public health?
I mean, that it would actually so there's, in addition to what's already happened, which has destabilized a lot of the public health sort of infrastructure, because there's uncertainty, there's cuts that have been made, there's loss of personnel throughout the country. The budget would propose really huge cuts for, some of which were already leaked before, 40% cut to NIH, huge cuts to CDC, elimination of whole areas of CDC. Overall, I think a third cut to HHS's discretionary budget. So this would, in addition to what's already happened, significantly reduce the capacity of public health in this country. One interesting exchange was this idea of like giving the power back to the states to do the public health. They know what's best. And I think, that's a philosophical difference about whether the state should make the decisions about how to spend money or not. But what was interesting, the question was about cutting the money. And the answer was, well, we're going to give that back to the states. The states can't make up the public health money. I mean, that's just, most public health money is coming from the federal government. So whatever your view is about how it should be spent or where it should be spent, the money, if it's cut in the budget and it's clawed back now, is a serious hole in the nation's public health system.
Yeah, I haven't seen any indications that any of this money that's being cut is being sent back to the states, which was a little bit of what happened, I think, in the Reagan administration. They block granted a lot of specific programs, and then they did send that money back to the states. But that does not seem to be what's happening here.
No, there is a proposal in the budget to do that for CDC, to consolidate. So one of the criticisms or issues that's come up over the years with the CDC is that Congress has line itemed it so much that it has, a line item for every disease, or even more than one for multiple, for the same disease. So there's been a move to try to make that easier for CDC. And this was both Democrats and Republicans have recognized this. So they're proposing to consolidate several of the disease line items into one. HIV is conspicuously out and not mentioned in that, and it didn't even come up in any hearing today, so that was interesting. But what's not clear is if they do that consolidation, if they say, okay, we're going to say states, here's your money for TB, here's your money for opioids, here's your money for STDs. That's good on the one hand. States know what their population might need, but it also means that a governor or could say, I don't care about TB in my state. I'm not going to fund it. So it does create these, when you're thinking about public health, where everybody, it's sort of like an all or nothing. What happens in one state affects the other. It could get risky to do that as a strategy.
So here's something we talked about a little bit, but I like the way this question is put. It said, how is it permissible that so often his response to questions was, reach out to me or my office and I'll look into that for you. Members of the public should be able to get responses from agencies rather than going through a legislator. And actually, there was one legislator, I think it was Tim Kaine, who pointed out that even their offices have been unable to get information from this administration, that their caseworkers haven't been able to get questions answered.
Yeah. You'd hear it occasionally before when, before in previous administrations, when members of Congress would ask particularly big stumpers. I sort of agree with the spirit of the question that it seemed like an unusual volume of like, let's just work it out privately was present here. So, it's definitely notable, especially given the fact that Kennedy has promised radical transparency, the most transparency, and so on and so forth. So that's interesting.
I mean, one of the things that's been notable in this administration is how much information has been disappeared, if you will, from public health and other HHS websites. I know some of it's now being restored under court order, but one of the things that characterized, I think, the first 100 days was making an awful lot of things less transparent rather than more transparent.
Yeah, I don't think we really even know where all the job cuts have happened and all the departments that have been, disbanded. Even that information was something that Democrats were trying to learn more of in this hearing. So,
yeah.
Agree.
I mean, there's between the public facing information that's been removed and then some of it's come back, but it's been changed. And so there's less information. And then of course, this whole process that's happening with RIFs, with reorganization, with cuts has been very challenging. Frankly, a lot of information's in court filings. Not that the average person reads those court filings, but there's a lot of information in the court filings that document these things, these steps that have happened.
Here's an interesting question. After listening to the hearing, what's the single most urgent threat to public health from the committee's perspective, and how does that differ from Secretary Kennedy? Obviously, we had two different committees, and they all seem to have kind of different impressions of what they think is most important. But were there some sort of themes that went throughout?
Well, the theme of the morning, as one would expect, there the appropriators was, wait, we're telling you, here's the money we want you to spend. You can't decide without us not to spend it. So that was that was one big theme. And then they were hammering him on vaccine stuff. So that was the second, was not trusting the administration and HHS on how it was going to handle vaccine guidance and recommendations.
And he got some criticism too on the autism study, I noticed, at least in the first. The first one, that was an area where, again, there was some divergence between what the committee thought was important and where he was at.
Yeah.
I just thought it was the weird distinction between kind of hugging it out and, fist to fist conflict, right? I mean, you'd get at one moment senators pledging to crack down on pharmaceutical advertising and the next calling each other liars, right? So, I mean, I doubt it'll happen, but you could foresee a future where they all just agree to crack down on pharma advertising or bad pharma stuff or something like that. I doubt it'll happen, but it was weird how much agreement there was amidst the accusations of lying and.
Yeah, and that was notable, I think, in both committees. I mean, it wasn't, that both of them were sort of a combination of, yes, I agree with you on that, and no, that's not true, and that's not what I did. There was, and it wasn't just Republicans and Democrats. I mean, it was almost like watching four different hearings in two different hearings. Were any questions posed to Secretary Kennedy about who actually stands to benefit from the proposed budget cuts and the elimination of existing HHS programs? I mean, I think certainly what Kennedy has been trying to say is that we're spending all this money, we're not making America healthier, so let's spend less money. Is that supposed to make America healthier? It isn't even so much that they're going to spend money on different things. I mean, there does seem to be an effort to just spend less money. Let's get rid of all of these, extraneous and redundant programs. But I do wonder, has he really addressed what he wants to do instead?
Kind of dips the toe in his prepared statement each time with like the idea that debt is a social determinant of health, that somehow the national, debt to GDP ratio, that he didn't use those exact words, but somehow more federal debt will hurt American health. It's an interesting argument, but he just kind of touched on it and went away. So the implication, I suppose, he's trying to raise is that if we cut the budget deficit, that we'll somehow be healthier in X number of years. I don't know if that's true or not, but that was something he kind of played footsie with.
All right, we're running out of time, but I think you have time for one or two more. Any news on RFK's health status following his Rock Creek Park swimming adventure? Do you think that stunt will increase people's disregard for no swimming ordinances? Somebody should explain what this is for the people who don't know.
This is Rock Creek Park, which is a beautiful park that winds throughout DC, and it has beautiful creeks. And unfortunately, there are very high E. coli levels in these creeks, which was very sad to my kids growing up, who very much wanted to swim. But Kennedy,
I don't let my dog swim in Rock Creek.
I have let mine. But even though there are lots of signs posted "Do not swim" because of this issue, he posted pictures of him and his family, not just wading in Rock Creek, but underwater. And I think that headline writers had quite a time with it, writing, Kennedy gets crap for swimming in E. coli infested. But I did not see any that was not raised.
Yeah. And he looked fine. I would point out that he was swimming in a tributary of Rock Creek, but a tributary that has also been tested and also been found not safe for swimming. So the part of the Rock Creek watershed that he and his grandchildren were swimming in was also deemed not safe. All right, well, I'm going to wrap this up. I want to thank all of our panelists here, Jen Cates, Darius Tahir, Stephanie Armour, and thank our team here at KFF, especially Hannah Norman and Connor Galvin, who put all of this together. I will be back tomorrow with this week's What the Health podcast, as usual, and we will post the recording of this on our YouTube page. Thanks, everybody, for joining us.